Joining me now is infectious disease specialist Dr. Isaac Bogoch. Welcome, Dr. Bogoch. Thanks for taking the time to talk to us. So we're going from COVID to monkeypox. What is monkeypox, and how concerned should Canadians be?
Yeah, so monkeypox is a viral infection. It's found in West Africa and Central Africa. There's been notable outbreaks in those regions for years. It was initially discovered in the 50s. Once in a while, we see cases exported from there. They land in the UK, elsewhere in Europe, or North America. There's been occasional small chains of transmission associated with those in the past. This is obviously much larger than those prior outbreaks. And, I think, we always have to couch this because this is a virus that we know a little bit about, but not a lot about. Certainly we're not starting from scratch with this. But in general, I think the risk to the community right this moment is very, very small. But obviously, you don't want to sweep this under the rug. It's got to be taken seriously. We've got to identify cases quickly. We've got to inform the general population about what to look for, inform people how to seek care if they think they have symptoms, provide people with appropriate care, and of course support public health in identifying cases in the close contacts so that we can prevent this from spreading more.
So 2 cases have been confirmed here in Canada. How do we prevent more transmission? Is it the same as COVID, masks, wash your hands? Tell people what you should do, or are we worrying, too soon? Well,
let's put it this way. There's 2 confirmed cases. There's going to be more. Obviously, there's going to be more. We know there are more cases than this. There's several under investigation. And this has a long incubation period. So this is going to grumble along for a while until people are really identified, treated appropriately, and their contacts are identified. So I wouldn't be surprised if this grumbles along for a longer period of time, like weeks and weeks. And we have to see how this evolves. The way this is transmitted is through direct contact with an infected person or being in close contact with a person. This can be transmitted through the air between people. And as we heard earlier, it is related to smallpox. And in fact, there has been distant transmission from person to person through the air. I should remind people, this is not COVID, this is not COVID, this is not COVID, but it is a transmissible infection. But it's not, based on what we know, it's not nearly as transmissible as COVID-19, for example. So good hand hygiene and if people are in close proximity with a known case, a mask would help. And in fact, when you look at what do healthcare providers do if we have a known case in hospital, we would be wearing an N95 mask, and that patient would be isolated in their own room so they wouldn't infect other people.
Well, that's certainly something to follow. Not great news, but at least we know that there are only 2 confirmed cases. Dr. Isaac Bogoch,
okay.
Thanks for taking the time.
Take care.